For over 35 years, La Colaborativa has supported Latino residents in Greater Boston. Now the organization is teaming up with Mass General Brigham to launch a new community initiative in Chelsea. It's called Bridge to Health, or Puente a la Salud. The goal is to bring health services and programs to prevent health issues to the La Colaborativa Survival Center. That includes screening for conditions like hypertension and diabetes, and importantly, delivering those services regardless of the patient's financial status.
Having this clinic means we can finally get the help that we need without stressing about how much it's going to cost.
The clinic also includes a state-of-the-art teaching kitchen that will host nutrition and counseling and how to adopt healthy habits. And joining us now is Alex Train. He's the Chief Operating Officer at La Colaborativa, and Dr. Priya Sarin Gupta, Medical Director for Community-Based Clinical Programs at Mass General Brigham and Medical Lead for Bridge to Health. How are you both?
Pleasure to be here. Thank you so much, Karen.
Good to see you. Alex, as we just heard, cost is a very big barrier to seeking health care. What are some of the other barriers in Chelsea and similar communities to getting medical attention?
So the barriers to communities seeking medical attention are manifold. So back in 2020, Chelsea was the epicenter of the pandemic. Our founder, Gladys Vega, and our leadership, Dini Paulino, knocked on thousands of doors to forge trust with residents and build bridges between the community and healthcare. What we found was that both distrust and cost were the two major barriers experienced by residents, whether it's insurance status or simply the co-pays that are necessary at the doctor's office. These are out-of-pocket expenses that many low-income families can't afford, and we're really thrilled to partner with MGB to finally address.
Dr. Gupta, you've spent quite a lot of time in the community. What health issues do you plan to target first?
So we've come up with what health conditions that we plan to target first based on what the community needs are, both by working with organizations like La Colaborativa and also data. And some of the conditions that we'll be focusing on initially are focused on hypertension and diabetes, maternal health, and cancer screening.
So, Dr. Gupta, Mass General has had a community health center in Chelsea for decades. How is this initiative different?
Right, so this initiative is adding to the care. We've actually worked very closely with our community health center leaders in addition to working closely with our community partners to design this initiative. And the idea is to really take that high quality care, clinical care that Mass General Brigham provides in our brick and mortar facilities and bring it out to the communities with partnership with community organizations right to where people are, where people live and work.
Can you tell us how you're planning to enhance the medical options that are available to residents?
I think some of the key ways that we plan to enhance the care is to really build in this component around helping individuals navigate the healthcare system, supporting social risk factor mitigation that's very specifically disease or condition focused, such as food insecurity, but approaching it from an angle where we are addressing it so it complements someone's health outcomes.
You know, they call it managed care because you have to manage it yourself. It's very confusing often. During the pandemic, La Colaborativa expanded its mission, opening a food bank and even providing health care, partnering with Mass General to open a mass vaccination site in the neighborhood in an effort to overcome racial disparities. Alex, how did the experience help establish this new concept?
So that experience was really foundational to establishing this new concept. You know, whether it's a lack of trust and absence of multilingual doctors or the affordability issues that crop up in healthcare, our residents face immense obstacles to quality ongoing care. And so what our experience and what Gladys Vega's experience during the pandemic really spawned was the vision for this integrated health center that's both embedded in our survival center in a trusted location, but more importantly, it's paired with navigational services. So Mr. Gonzalez can come in and see a doctor relative to his diabetes, but he can also access our food pantry and be paired with a youth who can assist him with running errands and maintaining a high degree of quality of life. And I think that's what really separates this from your traditional doctor's office setting.
So it's wraparound services, more holistic?
Absolutely, absolutely.
So the influx of new immigrants into the community has added another layer of need, I would imagine. How is the new partnership helping to address that mission, serving those new residents?
That's a great question. So, for decades, Chelsea has been a welcoming gateway community for successive waves of immigrants. So what we're experiencing now with new arrivals from Chile, Venezuela, and Haiti is not dissimilar to what we experienced 10 years ago with the arrivals of unaccompanied minors. And so both our experience shapes how we structure programs, but more importantly, how we build those bridges between new arrivals and medical care, because all of this is predicated on both trust, relationship building, and being able to address all of their needs, whether it's housing, job assistance, or health insurance. Without doing that, they're unable to focus on their health. So we prioritize that type of wraparound service approach before we delve into the chronic diseases that they may be facing.
Alex, this must be very exciting for you to see this come to pass. How does it make you feel to see this launched?
We're amazed by this. Our partnership with Mass General Brigham has been tremendous. They've been long-standing partners of ours. Our community has been reacting immensely positively to this on a daily basis. When I walk in, I'm talking to residents who haven't seen doctors in decades, and they're able to both connect with Priya and her team, as well as seek housing and food assistance in an integrated setting.
Dr. Gupta, what gaps from your perspective do you see this partnership filling in? And to you as well, it must be exciting to see this launch.
Very exciting. I think this work is really championing, us as Mass General Brigham doing what we do best, which is clinical care, and La Colaborativa capitalizing on what they do best, which is as a social services agency, meeting individuals' social needs. And I think that the biggest gaps that I envision moving the needle on is health disparities around hypertension and diabetes and preventable chronic conditions that just have gone too long without addressing these very needs in these very communities. But I think the other gaps that I see us addressing are engaging more individuals in healthcare to begin with, so that not only we can improve, morbidity, increase lifespan, but also decrease suffering. Do
you plan to measure results over time and see how this service has impacted the community?
Yes, very much so. So we're going to be working closely together with La Colaborativa to track health outcomes and all the different ways that we're making an impact, so that this model can really serve as an example for the state and the country on how best we can take care of individuals and communities that need us most.
Okay, this sounds great. Thank you so much, Alex Train and Dr. Priya Sarin Gupta. Thank you both for joining us.